Today we're going to be talking about common causes of wrist pain, and actually, I guess it's part two. And welcome back, Dr. Dragan.
Thank you.
Ray, when we talked about this last time, and we were going through all the wrist issues that were associated with, certainly with fractures and the like, and things that you can do now that we never had available to us before. We talked a little bit about carpal tunnel syndrome on our previous show. Today, you're really going to be talking about more of the arthritic complaints that people have that can present themselves to you. And in the past, it's one of those things we just kind of dealt with and took our arthritic medication and hope it got better. But in fact, as we've done with many of the joints, there are surgical treatments of that, and that's, I guess, we're going to cover today. So talk to me a little bit about the breadth of arthritic complaints of the wrist that you're seeing and the spectrum of that.
Well, I see a lot of complaints about pain in the wrist related to arthritis. It basically is mostly a wear and tear process that we see as people age, oftentimes a result of hard use of the hands or maybe a previous injury. It might have happened a long time ago. Sometimes people weren't even aware of these injuries. So typically most of the people that I see have been dealing with it for a while before they finally come in to see the doctor.
Yeah, you talked about, let's just talk about occupations. That's the one thing that comes to mind, and we talked about that with carpal tunnel and some of the inaccuracies of some of the ways that people present themselves. But in degenerative arthritis, I mean, are there any particular industries you think of that drops to mind that you're seeing consistently that people are now presenting themselves with arthritic complaints?
Well, certainly the laborers who use their hands very hard repetitively year after year are the ones that we really see the most. But we also see certain types of wrist arthritis in women, even more commonly for certain types, and not necessarily because of heavy labor, but maybe because of ligamentous laxity that might be more common in women that is sort of a setup for degenerative arthritis, or maybe just repetitive use but not necessarily extremely strenuous.
Yeah, I have to kind of think of the age we're in now and the need to be able to use your hand and wrist in texting and typing and all the computer use that in the past was not as prominent. But I can see that, the loss of the ability to do that in the future could be really potentially
Absolutely.
catastrophic to you.
Yes.
So your goal is to maintain function.
Right.
So what type of, you alluded to the fact that some of this is just degenerative arthritis as part of the old aging process. Are there other arthritides that can affect the wrist?
There are. Certainly degenerative arthritis is what we see the most of, but rheumatoid arthritis is also another fairly common cause. It's a different process. Degenerative arthritis basically means that the articular cartilage, the smooth surfaces of the bone, have worn down. They start to get rough and then they become painful, whereas rheumatoid arthritis is more a reaction to an inflammatory process. The patients develop a synovitis. The synovium is the lining of the joint, sometimes becomes inflamed and becomes very aggressive and can attack the surrounding soft tissues, causing the ligaments to stretch out, but also it may attack the articular cartilage and cause the joint to become destroyed and even the bone to be reabsorbed. So oftentimes the deformities there are much more severe than what we would see with degenerative arthritis.
Yeah, we certainly see that with rheumatoids.
We also see the crystalline arthropathies such as gout and pseudo-gout. They're both also pretty common. They have a different presentation. Most of those are acute onset, where a patient comes in with a sudden onset of pain, not necessarily any precipitating event, no trauma, but they often appear with loss of range of motion, swelling. The joint might appear hot or warm. And septic arthritis or infectious processes can also occur in the joint. And sometimes that's a result of penetrating wound or even possibly a hematogenous spread where bacteria gets into the bloodstream from another area, ends up in the wrist or another joint, and can cause a sudden onset of pain, swelling, and actually a very similar presentation to gout. So sometimes those can be difficult to differentiate from each other.
Yeah. Yeah, I'm intrigued a little bit by the gout, having been an internist in my previous life. But I'm always, you usually think of that as a toe symptomatology, as a presenting symptoms, and why it's selected there, I really never did know. But you don't normally think of the wrist as a primary manifestation of gout, and I'm intrigued by the fact that you've actually seen that.
Yes, absolutely. The wrist is not too unusual. Fingers also. Almost any joint can be affected by gout.
Yeah, amazing. But when you're looking at a patient, obviously the presenting symptoms of a gouty symptom is a little different than a degenerative problem, one being more acute than the others.
Right.
Just to go back to that issue, do you, diagnostically, can you aspirate that joint and make your diagnosis from that?
That's really what's necessary to differentiate between the crystallines and infectious. We'll put a needle in the joint, look at the fluid under the microscope, culture it and analyze it, see if there's bacteria in there, see if there's crystals in there, uric acid or calcium crystals. And but sometimes they can coexist. Sometimes you can have infection and gout at the same time.
Yeah.
Treatment for gout is going to be typically medical treatment, medications, or maybe a cortisone injection, whereas infectious arthritis requires surgery to drain it and a long course of antibiotics.
Yeah. And again, in degenerative arthritis, do you ever need to aspirate as part of your diagnostic document, or is it really one of historic?
Sometimes patients will still present with a big swollen, painful joint.
Even
they might have an acute exacerbation of
Sure.
their pain, and oftentimes we'll aspirate it, and if we're pretty sure it's a degenerative and not an infectious process, then we would inject some steroids into the joint.
Right.
Quiet it down.
Is it usually unilateral, bilateral? I mean, if you have a bad wrist on one side, you're more likely to have the same symptomatology in the other, or it may not be?
Certain things are a little more common, such as common bilaterally, such as arthritis at the base of the thumb, but many of the other arthritides are unilateral, might be isolated conditions. Some are related to previous trauma, but some people are just prone to arthritis and may develop it diffusely. They might have it in their knees, their hips, their wrists, and that can just be degenerative arthritis. We typically see that with rheumatoid arthritis where there's diffuse involvement, but we do also sometimes see that with degenerative.
Depending on the, I mean, we talk about arthritic symptoms, whether it be knee, hip, whatever, predominantly a lot of the symptomatology is at nighttime. You go to bed, it keeps you up. I would assume they can have the same type of pattern?
They can. A lot of the wrist problems occur with movement and use. Sometimes rest relieves the pain, but certainly when patients start to progress to the point where they have nighttime symptoms also, that's often what brings them into the doctor.
Yeah, got to do something about it now to keep me up.
Can't interfere with the sleep.
That's exactly. But you've alluded to the fact that movement can do it. Is it, we talk about the flexor and extension issues. Is it, you see more with one or other activity that, from a diagnostic standpoint, that you do?
Well, it depends on the location of the arthritis. One of the things I'd like to do today is basically start on one side of the wrist and move to the other and cover each of those little areas and how we would treat them.
Okay. Well, why don't we take a break and we'll come back and we'll start looking at the wrist itself. And we'll be right back after this message.
Okay.